When our patients come in for surgery, we want to be sure that they have a normal blood clotting process so that they don't bleed out on our OR table. There are many drugs that our patients could be taking, such as Coumadin, Lovenox, Xarelto, Eliquis, heparin, Plavix, nitroglycerin, ibuprofen, or aspirin, which could affect the ability of our patients to clot. You've probably seen commercials on television for most of these drugs. Ibuprofen and aspirin are pretty common drugs that a lot of people take for pain relief or arthritis. Many of these other drugs are given when our patients have had a heart attack or a stroke, or when they've had other problems with blood clots, unwanted blood clots in their system. For a planned surgery, the doctor will ask the patient to stop taking these drugs a few hours or a couple of days before the surgery, based on which one of the drugs they're taking. And in order to find out if that was effective, we will do a couple of different tests, which will tell us if their clotting factors are working normally again. If the test comes back and says that our patient's blood clotting response is not at a normal rate, then we may have to delay the surgery until it is safe. So if the blood clotting test does not come back normal, we might delay the surgery until the next day. If it's an urgent case, we might delay it until that night. And if it's a really emergent case, then it's possible that you would go ahead and do the surgery anyway. You just might not expect a great outcome. In order to test for this, especially in patients that have been taking an anticoagulant such as warfarin or Coumadin, we have two tests available to us that we're going to cover in the diagnostic testing section of our book, and they are going to be the Ptt Test and the Ptt Test. And you might wonder why there are two tests, and that is because there are two methods of the body for clotting. So your body has the extrinsic pathway, and the extrinsic pathway for clotting is going to be started by the tissues. So if you have tissue damage, the tissues are going to release factors that are going to start the clotting cascade. And in order to test for this, use the Ptt Test, which stands for time, which tells us how long it takes to clot. And if you remember, in our clotting cascade, prothrombin is right here. So this test is for the extrinsic pathway, the pathway that comes from our tissues. The other pathway in the body is the intrinsic pathway. And these factors come from our blood itself. So the intrinsic pathway is going to be triggered by components of the blood, and it is actually going to be most of the clotting process here that we've already discussed. And in order to test for that, we use the Ptt test or the Aptt test, and those stand for partial thromboplastin time, or the APPT is activated partial thromboplastin time. And this test just tests for the intrinsic pathway. So, for example, when we discussed the anticoagulants, we talked about how warfarin takes out vitamin K, which is going to reduce the clotting factors, and so it would reduce the ability of our patient to clot. These tests are going to tell us if both the intrinsic and extrinsic pathways are working. Now, when we talk about the Ptt Test for the extrinsic pathway testing the prothrombin time. There is also something called INR, which stands for International Normalized Ratio. A mathematical formula to make all the test numbers the same, so that if I'm talking about a patient and you're talking about a patient, we're talking about the same time frame. It's not specific to what test you used. The Ptt test is going to be used very often to test for a vitamin K deficiency, just like we talked about with Coumadin and warfarin, whereas the Ptt test is going to be used when we are talking about heparin, which we discussed inactivates thrombin, or prevents it from becoming active thrombin. So the Ptt test is going to test for heparin and drugs like that, and the Ptt test is going to test for drugs like Coumadin and warfarin. So there's two different pathways, two different tests that can tell us how well our patient is clotting.